Welcome to Monday's edition of COVID-19. I'm Min Sun-hee. We're starting the work week here with a significant drop in local transmissions, and under this scenario, public facilities including museums and libraries are opening their doors today in the metropolitan area. Meanwhile, imported cases remain in the double digits, and our Oh Jang-hee is poised to reveal to us the government's strategy with regard to dealing with infections from overseas. But first, here are the latest figures on the pandemic with our Kwon So-ah. Now, So-ah, here starting Monday, we are starting Monday, that is, with a decline in the total number of cases here in Korea.
That's right, Sunny. With just 4 local infections, we're seeing the lowest number of local cases in 73 days. And also with that, the total number of new cases was at its lowest in almost a month. So let's take a closer look at the figures. We have 26 new cases, bringing the total to 13,771. One additional fatality raises the total to 296, while 903 people remain in quarantine and 12,572 people have recovered. And let's take a closer look at this graph here. We started off at 62 last Monday, which means we're seeing that number reverse to 26. So quite a decline here. Also, since past last Friday, we are seeing a gradual decline. So let's hope the numbers stay at the 20s and do not go up to further higher numbers. But let's take a look at the regions now. We have 4 local infections, as I said earlier, and 2 of those in the capital Seoul, and 1 in Gwangju and 1 in Jeollanam-do province, which means the rest of these numbers are all imported cases, with 10 of those detected at the nation's airport or seaport. And we also have a dozen cases sporadically that were detected during the 2-week self-isolation period. And with that, let's get a check of the global situation. We have 14.6 million cases with more than 218,000 new infections. The death toll stands at 608,911, and 8.7 million people have recovered. And if we go over to the countries with major outbreaks, these 3 here at the top, the US, Brazil, and India, account for 7.1 million cases, which means around half of the entire world's caseload. A closer look here, 3.9 million almost in the US, almost 2.1 million in Brazil, and more than 1.1 million in India. And over in South Africa, we see the number at 364,328, and this country has made another jump, surpassing Peru's cases over the weekend. Let's move over to other places. So we have here Mexico, Chile, and Spain all in the 300,000s, and over 200,000 in the UK, Iran, and Pakistan. And a big concern here in Mexico, almost 40,000 fatalities, as this country has added more than 5,000 new deaths in a day. And of course, these continuous rises across the world are also affecting Korea's imported cases, and that's what our Oh Jang-hee is going to go in depth now. And I'll be back after the government briefing with more updates. Sunny?
All right, so thank you. I'll see you back at the desk. For the past week, the number of imported COVID-19 cases in Korea has outnumbered local infections. In response, the government has placed tighter restrictions on both inbound and outbound travelers. For more on this, I have our Foreign Ministry correspondent Oh Jang-hee here in the studio. Welcome, Jang-hee.
Good afternoon.
Right, Jang-hee, let's begin with this disturbing trend at the country's checkpoints.
Right, Sunny. The number of imported cases have fluctuated for the past week, but the daily average has been tallied at 31, which is not at all a small number. The figure went up to reach 47 at the highest, and the lowest was 13. Health authorities said they are confident about handling the situation because strict entry procedures are currently in place. But the situation is still worrisome because not all of them were detected at entry screening checkpoints, but in local communities, while the travelers were on 14-day quarantine.
Right, Jang-hee. So where are these cases coming from then?
Well, if we take a look at Friday's tally of 60 total cases, 19 came from 3 Russian ships docked at a port in Busan, plus South Korean workers returning from other parts of the world are also taking up a large portion. In the past few days, a large number of cases were reported among construction workers returning from Iraq, where about 800 Koreans are working. The government is planning to send a chartered plane to bring them back home this week at the earliest.
That is good to to know. Now, let's talk more about the government's new restrictions then, should we, Chong-yi?
Right. The government is adopting further restrictions on travelers coming from designated high-risk nations. Now, there are 6 of them currently. These are Bangladesh, Pakistan, Kazakhstan, and Kyrgyzstan, and 2 more were added to the list later on. Their names have not been revealed due to diplomatic reasons, but they are believed to be the Philippines and Uzbekistan. Travelers coming from these countries cannot take up more than 60% of the seats on a given flight. Also, it won't be as easy for travelers who visited these countries to re-enter South Korea. And all entrants starting last week are mandated to submit negative PCR test results taken within 48 hours of their departure. Plus, regarding crew transfers, previously foreigners entering the country to rotate crew members on maritime vessels were eligible for visa-free entry, but starting on July 24th, they'll be required to hold a visa and prove they've tested negative for COVID-19. This will apply to all except for 21 countries on a visa waiver agreement with South Korea.
Right. Now, I also hear there are some areas where these measures can be strengthened, Chong-yi.
Right. The concern is that these 6 high-risk nations that the government has designated are not the most high-risk nations because they do not include, among others, the U.S., Brazil, and India, which have the most number of COVID-19 cases. The government is cautious because these measures are diplomatically sensitive in nature, but they do not accurately reflect the outbreak situation in these respective countries. Plus, regarding mass infections found at foreign ships docked in South Korea, people are calling for a more diplomatic solution, but it's unclear how that can be done.
Right. Meanwhile, the government has extended its overseas travel advisory until mid-August. Tell us more.
That is right. The authorities are advising South Korean people not to travel overseas until August 19th, unless a further extension is made. The latest extension is the 3rd of its kind issued so far this year. The warning was first issued in March, and it was set to expire today. The government's latest move is based on the assessment that the current global COVID-19 pandemic is still serious, and a steady number of imported cases are being reported here in the country.
Right, Chong-yi, before I let you go, I hear there's been an update from the country's foreign ministry regarding Korea's humanitarian assistance to other countries.
That is right. Until now, the South Korean government has made $41 million worth of aid to 97 countries around the world. And last week, the foreign ministry unveiled plans for additional humanitarian assistance worth $12 million for 32 countries worldwide, including the supply of face masks and COVID-19 test kits. These include Brazil, which is seeing a spike in cases recently, as well as conflict zones such as Iraq and Afghanistan, which are especially vulnerable to COVID-19. Once it completes this latest round of humanitarian assistance, the South Korean government will have sent aid to 108 countries across the globe.
I see. All right, Chong-yi, thank you for that coverage as always.
My pleasure.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular government briefing on COVID-19. As reported by our Kwon So-ah earlier, Korea's daily infection numbers have dropped to below 30 on this Monday for the first time in more than 3 weeks. Now, of the 26 new cases reported today, only 4 were local transmissions, while 22 were imported infections. And speaking of infections from overseas, Korea has been witnessing double-digit growth with regard to these cases for 25 consecutive days. Officials are now linking the more recent rises in import cases to Korean workers returning from Iraq in a series of cluster infections on Russian-flagged vessels in the port city of Busan. Health authorities have also dismissed concerns of community spreads by these imported cases, that is, pointing out that most of these infections were identified at airports or during the 2-week mandatory quarantine period. Meanwhile, public facilities such as museums and art galleries as well as libraries are poised to open doors today in the metropolitan area in response to a drop in local cases. Visitors are being advised to wear face masks and to keep their distance from those around them as part of safety practices. Also, members of the public are being asked to stay at home and to monitor their conditions should they feel sick or believe that they might have been exposed to the virus. This precaution comes as many seek to make the most of the summer season by heading to vacation spots with little regard for prevention efforts. Health authorities believe that the summer months may serve to be the critical juncture of the country's anti-virus campaign. So far, Korea has conducted more than 1.4 million COVID-19 tests. We are still waiting for that briefing to commence, and perhaps while we do, we can take a look at the figures for Korea for this Monday again. As we reported earlier, we have 26 new cases, raising our total number of infections to 13,771. One person lost his or her life to raise our death toll to 296. 900 that is, and 3 people remain in quarantine, while 12,572 people have fully recovered from the virus here in Korea. Also up next, the daily life distancing guidelines by the government to members of the public to ensure safety. I understand the briefing is about to commence, so we will come back to you afterwards.
First, here is Director Chung Eun-kyung with the briefing. Let us now begin our regular briefing for July 20th, Monday. As of today, we have a total of 4 new local infections and 22 new imported cases. And the total number of confirmed cases now stands at 13,771. 16 more people have been discharged following full recovery, and about 91.3% of the total have been discharged, while 903 people remain in quarantine. And 19 of the patients remain in critical conditions, and we have 1 fatality as of yesterday, with the death toll standing at 296. I extend my deepest condolences to the deceased and the members of the bereaved family. Here are some updates on our domestic infections. In relation to an office building in Gwangju District, Seoul City, we have 1 additional case, and a total of 33 cases have been confirmed. And in relation to V building, and also we have found that there is a relationship between a V building in Gangnam-gu District as well as Hanwha Life Insurance Company, and we have 2 additional cases with a total now jumping to 24. And in relation to a long-term care facility in Seoul's Gangseogu District, 9 people have been confirmed, and we are currently conducting epidemiological investigations. And here are some updates on our imported cases. As of today, we have a total of 22 new imported cases. 10 of them have been reported at the points of entry, while the rest 12 have been detected during their self-quarantine. And the countries include 4 people from US, 9 from the Philippines, 3 from Pakistan, 3 from Iraq, and 3 from Pakistan. To this end, the KCDC has monitored the risk factors for the past 2 weeks and are as follows. During the past 2 weeks, we have seen that 95.9% were imported cases, while 24.3% of the total infections were local infections. And a total of 8.2% are also under with unidentified sources of infection, and which has decreased in proportion from the 2 weeks earlier. We are witnessing a decrease in the number of cluster infections in the community. However, we are still witnessing sporadic outbreaks at some of the multi-use facilities, and we have seen a decrease in the number of the age groups in 20 and 60s. However, we have seen an increase, a steady increase, that is, in the people ranged between the ages of 40 and 50, especially centering around the door-to-door facilities. And starting from today, the quarantine authorities will increase the number of high-risk designated countries to a total of 6. And we will be continually monitor the trends overseas. And they also include restriction on visa issuance and also limiting of the capacity of the passenger flights, as well as a mandatory submission of a PCR negative testing results once they enter into the country. And these are some of the measures that are being taken to curb the further influx of the imported cases. And going forward, we will also monitor the global outbreak, and we will also assess the other countries based on such risks of infection, and we will intensify our quarantine measures to this end. And in order to curb the further local transmissions here in the country, we will also ask all of the members of the public to comply with the quarantine measures, especially at door-to-door facilities. And these door-to-door facilities started from the Rich Way here in Seoul, and also it spread to other regions of the country, including Daejeon and Gwangju as well. And we have a total of 24 people who were in critical conditions, and we had a total of 7 fatalities in relation to door-to-door sales. And they also spread at venues like information centers and promotion centers, which were carried out at enclosed spaces, and they also were enjoying meals together. This means that they have a higher risk of infection. And especially for those in the senior age group, we ask all of them to avoid going to these places and facilities. Moreover, in relation to these establishments, if you have developed any symptoms after visiting these facilities, please get tested as soon as possible. During this week, we ask all of the members of the public to comply with wearing a face masks and washing of your hands, and please make it a habit to comply strictly by these quarantine measures. And for all of those who are working at long-term care centers, we also ask you to strictly comply with quarantine measures. And the KCDC will also continue our monitoring of the situation, and as today marks the 6th month of the COVID-19 fight, we would like to bring you some analysis. And after the first patient being confirmed on the January 21st, as of today, we have a total of 13,771 confirmed patients. And we have identified that those in the 50s had the highest proportion, and the female patients were also higher than those of men. And as for those in the critical conditions, we have done an analysis for mid-April, and we have identified that about 9.1% were in critical conditions in need of oxygen-related therapies. And the fatality rate right now is standing at 2.14%, and it increases steadily according to the age group. And for the people aged over 80, it is over 25%. And we have identified that all of 70% of our fatalities were also centered around the nursing hospitals as well as other long-term care centers, meaning that these high-risk facilities need special care. And before April, we have seen that the virus type S and V was also spreading. However, this changed recently as well. And also about 31% of the total were imported cases, while 14 were imported cases. And also out of the imported cases, most of were Koreans, while about 30% were foreigners. And also in relation to cluster infections, Shincheonji group-related cases were also the highest among the others, with over 30%. And also this came into a list of other facilities as well. And in the earlier stages of the epidemic, we had a sporadic outbreak and exponential increase of the confirmed cases centering around religious facilities. However, these were also subdued because of the participation by the public in the distancing measures, and we have seen a subdued number of the confirmed cases. However, in early May, we have also witnessed a spread of another cluster infection centering around the high-risk facilities, including bars and clubs at the metropolitan area, and it's also continuing to spread, especially through sporadic occasions. And we also have been able to curb the spread of the virus thanks to the public's participation in the distancing measures. And in preparation for a prolonged battle against the COVID-19, we will continue to curb the virus going forward. And here in Korea, it has been 6 months since we first identified the first case of the COVID-19 patients. And even at this moment, the COVID-19 is continuously to spread right now. However, it is also important to note to note all of our response measures up until now. And it is very important for us to reveal and to reflect on our past to prepare for the future. And we have seen numerous crises, including this Daegu Shincheonji as well as Itaewon Club case. However, we were able to control the situation fully thanks to the support and participation by the public. Although we are at difficult situations, we were able to overcome such difficulties thanks to the trust by the public. So as an official in care of the quarantine measures, I would like to extend my deepest gratitude to all of the members of the public as well as local governments and the medical practitioners. Of course, we had some loopholes. We would like to address these going forward. And here are some of the areas that need improvement. First, for us to decrease the number of influx of imported cases, we have been having quite a good control of these imported cases through diverse means. And we are also classifying the countries in terms of high-risk groups. And also, second, we were able to prepare and to conduct a swift and massive testing of the PCR testings of the contact cases, and we were able to decrease the number of contacts by this way, and we also utilize the QR codes and other ICT technologies, including the self-diagnosis application as well. And third, our treatment centers, especially the life treatment centers and also the regional responsive scheme, and also the treatment designated centers for infectious disease controls were also put in place. And fourth, we have been exerting efforts to stabilize the distancing measures, and we have intensified measures to wear face masks and keep a healthy distance. And we have also made these schemes into different ranges and levels, and especially centering around schools, public transportation, and multi-use facilities, we were able to station a very good and effective and practical measure to curb the virus. And last but not least, we had a good cooperative governance between the local governments as well as the central government. Under the leadership of the Prime Minister, we also shared information with the local governments, and we also tackled any of the regional issues, and we also asked for the cooperation by the private sector as well. However, we also have some areas of improvement. We have seen a higher fatigue among the medical practitioners, and also we are seeing a lack of social support, and also we are seeing a lack of the expert personnel who are in charge of treating those people with critical conditions, and also we have been seeing other issues as well. And taking the consideration that the COVID-19 battle is going to be a prolonged one, which is inevitable, we need to also look at our medical system and our social system, and we need to make sure that our COVID-19 epidemic is under our manageable capacity and to able to minimize possible damages. And in order to do so, on top with the current responses, we need to come up with further measures as well. First, we need to secure and have great access to a possible vaccine going forward. And this is also something that calls for international coordination as well. And second, we need to secure and expand our medical facilities as well as personnel. We need to increase the number of hospital beds as well as medical experts who are taking care of those in the critical conditions. And we need to make sure that we have a very stable and safe medical facility. And we also need to intensify our support and protection against our high-risk categories people. And we need to also intensify preventive measures going forward. And fourth, we need to have a great efficiency in our epidemiological investigation, and we need to increase the number of personnel. We need to revamp our ICT technology and our information sharing scheme as well. And last but not least, we need to also change our social culture so that we can keep distancing going forward. And we need to expand the support, including sick leaves and so forth. And we also need to prevent, make it a habit to make disease prevention controls into a daily routine. And this also calls for education and training. And the quarantine authorities will continue to cooperate with the local governments, and we will effectively control the virus going forward to a mid and to long term. And now we are given a condition that we will have a prolonged COVID-19, and now it is time for us to live wisely and healthy with COVID-19. It is very important for us to avoid 3C environments which spread the virus fastly, and we need to wear face masks, wash our hands, and disinfect our frequently touched surfaces as well. The quarantine authorities will also continue to stay vigilant, and we will also exert our full efforts. Thank you very much.
Right, that was Chung Eun-kyung, the head of KCDC, with Monday's afternoon briefing. So do give us a summary of the key announcements.
All right, well, it's been exactly 6 months since the first outbreak here in the country, and that is why the government made an assessment of the past 6 months. And just to give you a few numbers that came out there, it looks like people aged 50 and above accounted for the largest number of infections, and also a little more, the proportion of females was a little more than males, and then the death rate of people aged 80 and above was at 25%. And according to the government and the nation's people's coordination, and also the various quarantine measures that are included in the K-quarantine measures, are what made Korea come to this stage where we can have the virus under control. But still, imported cases are on the rise, which also can be seen today as we have more than 20 new imported cases. So that's a task that lies ahead.
Right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
Efforts to ease the plight of people amid the prolonged pandemic have extended well beyond the medical sector. Officials in community centers here in Seoul have come up with diverse ways to better respond to the needs of both patients and non-patients. We have details in this report.
This is the Seocho Animal Care Center, a facility that provides shelter for lost and abandoned pets, located in Seoul's Seocho district. A typical day here starts at around 10 a.m. when the facility is cleaned inside out. Sanitation has become especially more important due to COVID-19. Once the place is sparkling clean, it's breakfast time for the puppies here. The center primarily takes care of lost and abandoned dogs, but it also provides other services for dogs that do have owners.
반려견을 키우신 분께서 확진을 받으셨다. 근데 주변에 뭐 강아지를 맡기실 곳이나 돌봐주실 곳이 없다 하시면은 저희 센터에서 데리고 있으면서 이제 보호해주는 그런 역할도 하고 있습니다. 코로나 확산을 방지하기 위해서 들어오자마자 미용실에서 먼저 목욕을 시키고요. 씻긴 후에 저희 별도로 준비된 계류 공간에서 보살피고 있습니다.
For many people who are struggling financially and are looking to provide their dogs with affordable shelter, the center only charges around $4 for their services, just a fraction of the cost of pet hotels. The center also provides a variety of other animal welfare services.
저희 서초동물 사랑센터에서는요, 주인을 잃어버린 아이들이나 버려진 아이들을 원래 주인에게 찾아주거나 새로운 가족을 찾아주는 그런 일을 하고 있습니다. 서초동물 사랑센터로 인해서 유기견에 대한 부정적인 인식도 좀 바뀌셨으면 좋겠어요.
Next up is a mental health support center in Seoul's Gwangju district. Here, staff members are working hard to meet the mental health needs of local residents. These days, workers here have been busy making these so-called relaxation kits.
코로나19로 심리적 어려움을 겪고 계시는 주민들에게 심리 안정과 신체적 불편 완화를 도움을 주고자 만든 키트인데요. 총 10가지 물품으로 구성되어 있습니다. 심리 안정에 도움이 되는 종이접기 책하고 드로잉 붓기 있고요. 수면에 도움이 되는 목베개 수면 안대가 있습니다. 집에서 간단하게 스트레칭 할 수 있는 스트레칭 바가 준비되어 있고요. 마스크, 물티슈, 개인위생 물품이 있습니다. 격리 중에 홀로 집에 계셔 우울하고 스트레스를 받고 계신 구민들에게 심리 상담과 함께 우선적으로 제공하고 있습니다.
저희가 심리 안정 용품을 전해드리고 있습니다. 대면하지 않고 문 앞에 두고 가니까 안심하셔도 되십니다.
Workers are now delivering the kits to people in self-quarantine.
관악구 정신건강복지센터에서 나왔어요. 대갑에 물품 두고 가겠습니다.
Free psychological counseling hotlines are also available.
코로나19 상황이 종료되더라도 코로나 우울증이나 재난 트라우마로 고통을 받고 있는 분들이 있다면 관악구는 무료 상담과 전문 의료기관 연계 치료를 계속 이어가도록 하겠습니다.
Local governments and municipalities are playing an important role in providing key welfare services for their respective communities as part of wider efforts to battle COVID-19.
Meanwhile, it appears as though a second wave of COVID-19 is indeed unfolding across the globe. In this next corner, we take a look at the situation in Europe. I have Eileen Cho, a freelance journalist in Paris, live on the line. Hello, Eileen.
Hi.
Eileen, earlier in June, French President Emmanuel Macron hailed the country's first victory against COVID-19, but it seems as though infections are rebounding there. Please do start by telling us more.
So as of May 15, we've been able to go outside and stuff. And at first, we were pretty good at wearing masks and keeping social distancing. But once the restaurants opened, it was kind of a free-for-all. And then the protests started again. And so there have been an easier, attitude towards coronavirus, and the cases have been moving up. In the northwest of France, the region has actually turned red, a region known as Mayenne. And with all the traveling coming up for the summer, people are quite concerned. And even in Paris, as of today, the whole country has to wear a mask. And so I think the attitudes will soon change again.
Eileen, following President Macron's declaration of victory, protests have broken out across France. What is fueling these public demonstrations, and how are these demonstrations affecting COVID-19 containment efforts there?
So as we all know, for over the past 18 months or so, the Yellow Vests have been protesting. And as soon as lockdowns eased, they were back on the streets. And even the pictures show that people aren't wearing masks. They have them around their face, but it's not covering their faces. There was also a health workers rally protest a few weeks ago. More than 18,000 healthcare workers were out on the street, and then the police were tear gassing them. And I think that's quite shocking, as the pandemic is over a respiratory disease. And then beyond that, we have the Black Lives Matter protests, as well as the feminist movement protests, because Macron just announced his new cabinet. And the people just aren't happy. And French have a history of protesting.
I see. Eileen, starting from today, face masks, like you mentioned, are mandatory at indoor public places in France. Violators are poised to face fines of 135 euros. Please tell us more about this face mask wearing being made mandatory there.
So the whole time on public transport, we are required to wear masks, and they've been quite strict about it. So if you're walking around the Paris subway, the police will come and get you and arrest you if you don't comply. And as of today, everyone will be required to be wearing masks indoors, which wasn't really enforced. A lot of businesses did ask you to wear masks, but people didn't really listen. And now with this fine, it'll be interesting to see how the police arrest people or keep them accountable.
So health authorities are taking a tougher stance then. Eileen, the Louvre Museum reopened its doors after some 4 months of closure. What preventative measures are in place there, and are there many visitors there?
According to the Louvre, they had 7,000 visitors on their first day, which is quite great for them. They expect that in this coming summer season that their business will be down just by 30%, which isn't too crazy. So they are taking strict measures. You have to book your slot in advance. You're required to wear a mask if you're over the age of 18. Hand gel is given at the door. Groups are dispersed. But as you can see, there's still a lot of people there. And with tourism picking back up, with the EU's borders reopening within each other, they expect more and more people to come.
I see. All right, Eileen, thank you for making the time to join us live with your thoughts at this hour.
For sure. Thank you, Sunny.
바이러스가 인류의 일상을 송두리째 바꿨고 세계 경제를 무너뜨렸습니다. 수출과 고용 등 우리 경제에 미치는 충격도 본격화되고 있습니다.
The World Trade Organization believes global trade may fall by as much as 30% this year amid the ongoing pandemic. What's more, many nations, to a certain extent, appear to be leaning toward a protectionist stance. So how should Korea, an export-driven country, seek to respond to this reality? To answer this question and more, I have Professor Yang Jun-seok from Catholic University of Korea. Welcome, Professor Yang.
Happy to be here.
And I also have Professor Yang Hee-dong from Ewha Women's University. Hello, Professor Yang.
Hi, nice to see you again.
Right, Professor Yang Jun-seok, we'll start with you. What are your thoughts regarding the pandemic's impact on global trade? I mean, we've had protectionist policies in the years before the pandemic, and observers believe the pandemic has, to a certain extent, strengthened such propensities.
Well, I tend to take the last time we had these type of strategic protectionism in the global economy, which was around late 80s, early 90s, when we had a lot of concerns about strategic production of semiconductors. The United States tried to cut the imports from Japan. What happened was they didn't really bring the production back to the United States. They sent production to Taiwan and Korea. Now, what will happen after the pandemic? I think for some strategic medical equipment, medicines, some will be brought back into their home countries because they are thought to be very strategically important, but they can't do that for every good. They cannot do that for every good that country needs. So what would probably happen is they would probably diversify the sources, not only because of the pandemic, but because of the US-China trade war. Also in case of Korea, because of the Japanese export restrictions. I think people are more aware now that you should not limit your sourcing to just one country. So I think what will happen is we will still have a globalization, but perhaps it'll be more block-oriented. President Trump seems to be starting on this move. He wants to start a block of trusted countries, and perhaps that's where we're going. Rather than having a complete protectionism, countries will decide on some goods that they really need to have in their countries, and then for the rest of the goods, they will have diversified imports from trusted sources.
Right. Professor Yang Hee-dong, let's turn our focus to the US now for some broader perspective. The country's trade deficit is on the rise for the third straight month, and its exports have hit an 11-month low. Now, some say that the reality in the US economic arena is a reflection of global trade. What are your thoughts on this?
Well, it may be true and half, because the American economy does not necessarily heavily depend on the export, right? Their economy is quite different from Korea. So instead, we may take a look at the internal retail, internal consumption. For example, the CCSI, that's standing for the Consumer Confidence Sentiment Index, has increased to 79 in June. That used to stay very low, like 71 in April and 72 in May. That is very important, the index for the economic activity in the US. But getting back to the trade issue, the export has decreased to $146 billion in May, which is about 4.4% decrease, a reduction compared to April of the same year. And import has also decreased by 0.9% to $199 billion. So if we add up those two figures, then we can come up with the international trade for U.S. Unfortunately, that figure has decreased about 28% compared to the last year. So that is a very, very significant issue. And you may wonder why those, that luster figures have occurred. I think that there are a couple of reasons behind those figures. The first one is trade conflict, against China. And the second one is the global supply chain has dissolved, as the Professor Yang has mentioned. Now, the world economy has become blocked, like RC, AP, or many other block economies. It may take over the major role for the international trade.
Professor Yang Jun-seok, in a rather interesting turn of events, China, which reported the world's first case of COVID-19, saw its trade rise last month. What do you make of this finding?
Okay, well, if you're talking about trade, then it really depends on whether it doesn't really depend on country which exports, but the country which imports. The countries that import, are they doing better or are they doing worse? And for the United States, at least, for June in particular, their economy has been doing slightly better than what everybody thought. And Europe and other countries, they're coming out of the lockdown, so their demand, I think, has gone up. That accounts for part of the increase of Chinese exports. Other part is that right now, well, we can't completely trust Chinese statistics or sources, but right now they seem to have coronavirus under control. And at least from the reports, their outbreaks have been mostly limited to Wuhan and Beijing. So people seem to feel safe going to work. So that seems to be driving a lot of their increases in exports. And also their economy seemed to be doing well as well, partially because, again, coronavirus seems to be under control and people feel safer. So their economy seems to be on the overall recovering, though if the coronavirus starts again, has a second round, then anything goes.
Right. Professor Yang Hee-dong, back here in Korea, the country noted a slight drop in exports of 1.7% on year earlier this month. Now, this, of course, is no comparison given the 20% declines we saw in the months when the pandemic was in its worst cases. Given this scenario, do you believe Korea's exports will see a rebound perhaps in the third quarter?
Well, I would not go that far to conclude that the Korean economy has recovered, securely from this the pandemic, because the significant effect of the coronavirus has been realized since April. So, for example, in March, the export has decreased only 1.6%. But in April, our export has decreased by 25.5%. May, it got better somehow, 23.5%. And June, it decreased still at 10.9%. So even though we have the reduction in early July by 1.9%, we cannot conclude that we have recovered successfully. Well, you may wonder how can we have such a very small reduction in early July. Well, the major reason is that we have a huge demand for shipbuilding, and we have a great export of vehicles. But still, we have tons of problems for oil refinery that has reduced about 42% compared to last year. And also the automobile part that decreased about 34% last year. And besides the wireless, the device that has decreased about 11% compared to last year. So still, we have a long way to go to recover from this economic disaster.
Right. Professor Yang Jun-seok, further aggravating global economic concerns, of course, are trade tensions, like you mentioned, between the US and China. What are your thoughts on the prospects of trade talks between these two superpowers?
Okay, well, right now, if you're talking about the first stage agreement, China is way behind on their purchases. But there has been questions in the past whether China overpromised, because the amount that they promised to buy, especially in agriculture, outvalues the previous largest agricultural imports that China had. So there always have been questions on whether China can fulfill their promise. Now, the promise that they made was for 2010 and 2011 together. So, and President Trump's re-election is in 2011. And I think it's in China's interest to at least try to seem like they're going to keep to the first stage agreement, at least until they're sure whether President Trump will be reelected or not. So even though right now they're way behind on their purchases, or at least their purchase schedules, I think they're going to keep on saying that they're going to buy what they promised, at least until President Trump's reelection is over, and see whether he is reelected or not. After that, though, if President Trump is not reelected, they may try to renegotiate the agreement, and they may try to do a deal with President Biden, because President Biden, I don't think he'll be as interested in export targets for the United States as much as the rules concerning investment and trade and employment conditions in China.
Right. Professor Yang Hee-dong, speaking very briefly, Japan's trade restrictions, that is, against Korea, prompted the country to invest some $1.7 billion in 100 materials, parts, and equipment production. These equipments and material and parts are needed to make semiconductors, plasma TVs, and smartphones, which are Korea's top exports. How successful do you believe this investment by the government has been?
Well, it really depends, because there are three major materials that Japan has, declared to embargo the export to Korea. The materials are involved with the semiconductor and also the display and the equipment. So as for the hydrogen fluoride, which is also called the etching gas, we have successfully replaced the Japanese companies with the Korean firms such as Lam Technologies or Solbrain. But the other two materials, still we have a long way to go, because those two elements are related to implanting the designs over the wafer, and the other one is heat resistance, the films. But those two materials still a long way to go to localize our production.
Hopefully we will see some progress in that area then.
Absolutely, we should.
Right, all right, Professor Yang, thank you very much for your thoughts. And Professor Yang Jung-sung, thank you again for being with us today.
Thank you.
Right, well, that ends our first edition of COVID-19 for this week. Be sure to tune in tomorrow as we look at the presence of protectionism in efforts to find a vaccine for and a cure against, well, that would be a vaccine against and a cure for COVID-19 by countries worldwide. In the meantime, do reach out to us with your thoughts and inquiries through our social media accounts or homepage, Arirang.com. Thank you for watching.